This weight loss drug outperforms bariatric surgery. It's illegal to prescribe, but it's already showing up in med spas. I'm Dr. Kate D., founder of Glow Medi Spa in Seattle, founder of the Med Spa board, and author of Med Spa Mayhem. This is Med Spa Confidential, where we pull back the curtain on everything happening in the world of medical aesthetic and weight loss medicine, the good, the bad, and the outright illegal, because you deserve to know the truth. If there were a weight loss drug that could take off nearly a third of your body weight, would you run to your doctor and ask for it? Because that drug exists. It's called Retatrutide. And here's the thing, you can't get it legally right now. It is not FDA approved yet. And some people are already injecting it anyway. Today, I'm going to tell you exactly what Retatrutide is, why the results from the clinical trials are genuinely impressive, why the side effects give me real pause, and why, and this is my bottom line, I don't think the extra weight loss is worth it right now, not when tirzepatide exists. Okay, so if you've been following this podcast, you know I spent a lot of time talking about GLP-1 medications. We've done episodes on Ozempic face, the oral semaglutide pill, and the SURMOUNT-4 regain study, the whole illegal compounding situation. I'm not going to rehash all of that today, but let me give you a really quick primer on how these drugs work, because it matters for understanding why Retatrutide is different. So GLP-1 stands for glucagon-like peptide 1. It's a hormone in your body. It's naturally produced after you eat. It tells your pancreas to release insulin. It slows down how fast your stomach empties, and it signals your brain that you're full. GLP-1 receptor agonists, drugs like semaglutide, which is Ozempic or Wegovy, mimic that hormone and amplify its effects. On semaglutide, people lose on average about 15% of their body weight. That was huge when it came out, life-changing for a lot of people. Then came tirzepatide. That's Mounjaro for diabetes or Zepbound for weight loss. And I've said this before in this podcast, I personally think tirzepatide's the best drug out there right now. Why? Because it doesn't just activate the GLP-1 receptor, it's a dual agonist. It also hits the GIP receptor, the glucose-dependent insulinotropic polypeptide. And that second receptor amplifies the weight loss signal in a big way. On tirzepatide, people lose an average of about 20 to 22% of their body weight. Fewer side effects than semaglutide, better results. And I've been on the lowest dose myself, 2.5, and it's been steady for me over a year now. I'm a huge fan. So that's where we are. 2 drugs on the market, one that activates one receptor, one that activates 2. And then along comes Retatrutide, which activates 3. So what makes it different? Retatrutide, that's actually the brand name isn't set yet. It's still Lilly's LY3437943 in the trial world, is what they call a triple hormone receptor agonist. It hits GIP, GLP-1, and a third receptor, glucagon. Now, glucagon is interesting. Glucagon is the hormone that does kind of the opposite of insulin. It tells your liver to release stored glucose, and it also ramps up your metabolic rate. It burns energy. And when you add glucagon and agonism on top of GIP and GLP-1, you're not just suppressing the appetite and slowing digestion, you're also directly increasing how fast your body burns fuel. Your metabolism gets a kick in addition to everything else. Think of it this way. Semaglutide is like turning down the volume on hunger. Tirzepatide does that and also makes food less rewarding. Retatrutide does both of those things and then throws more wood on the metabolic fire. It is, mechanistically speaking, a more aggressive drug. And the results of the clinical trials reflect that. We're talking about phase 3 data from Lilly's Triumph program. And the weight loss numbers are stunning. At the highest dose of 12 milligrams weekly, participants lost an average of around 28 to 30% of their body weight over 80 weeks. In real-world terms, the average starting weight in one trial was about 248 pounds, and the average loss was more than 70 pounds. Okay, 70 pounds. That's not a before and after photo you see on a spa Instagram very often. That is bariatric surgery territory. And you're getting there with a once weekly injection. There's also a phase 3 data in type 2 diabetes showing major improvements in hemoglobin A1C, and a separate trial, Triumph 4, specifically in people with obesity and knee osteoarthritis, where they also saw meaningful pain reduction alongside the weight loss. So the drug is doing a lot of things right. Okay, so what about the side effects? Here's what I want you to really pay attention, because this is the crux of why I'm not ready to tell you to run out and find this drug. So that third receptor, glucagon, is what's driving the extra weight loss. But glucagon agonism is also what's driving a heavier side effect burden. And when you look at the clinical trial data carefully, the pattern becomes pretty clear. Let's start with nausea. On tirzepatide, nausea rates run around 30%. And honestly, I don't think that we've seen it that high in our program. But on retatrutide, at the highest dose, it's about 42 to 43%. That's a real jump. And vomiting follows, about 25% of participants at the 12 milligram dose. These aren't unusual side effects for this drug class, but the frequency is noticeably higher. More telling to me is the discontinuation rate. That's the number of people who stop taking the drug because of adverse side effects. That means the side effects were so bad that they quit. So for tirzepatide, that's roughly 14.9%. which honestly that's high compared to what our experience has been. I think probably we're pretty conservative in our program. For retatrutide at 12 milligrams, depending on the trial, it runs anywhere from 11 to 18%. At the top end, that's nearly 1 in 5 people stopping the drug because of how they feel. And that's not a small number. But here's the one that really got my attention, and I hadn't seen this with any prior GLP-1. Dysesthesia, okay? It's an abnormal skin sensation, tingling, burning, prickling, like a paresthesia, but weirder. Not painful exactly, but uncomfortable. And for a lot of people, it's alarming because they have no idea what's happening. In the retatrutide trials, dysesthesia affected about 21% of participants versus 8% on placebo. It's real, it's drug related, and it's unique to retatrutide. Most researchers think it's driven by the glucagon receptor component. The good news is that it typically peaks around weeks 4 to 8 of dose escalation and resolves by around week 24. So it does go away. But for 20% of people to experience this strange sensation in their skin, that's something you'd want to know up front. And to be fair, and I do want to be fair, Lilly calls the overall safety profile consistent with GLP-1 class drugs. And most of the side effects are transient, mild to moderate, and happen most during dose escalation. So 7 more phase 3 trials are still ongoing. So we're going to know a lot more about the long-term profile over the next couple years. But we're not there yet. And that's the point. And I have to say about these side effects, I kind of want to experience them myself to know whether I want to recommend things. I personally experienced the tirzepatide, and so I know from personal experience what it's like. And of course, after years of exposure to the drug and prescribing it, we know how people really react in the real world. But let's talk about the illegal use problem, okay? I know some of you are probably already Googling, okay, because retatrutide is not FDA approved yet. The NDA filing is expected around late 2026 with potential approval sometime in 2027 or early 28. But people are already using it, and the way they're getting it is through the gray market. Now, you've heard me talk about this before if you've listened to my episode on the Aurora IV and wellness case in Alabama recently, the med spa that injected roughly 100 patients with research grade compounds labeled not for human use. You know exactly what this looks like. Research grade peptides, bulk powder sold by the gram. Suppliers who put a disclaimer on the label that says not for human use while selling it to people who are absolutely using it on humans. Now, I will say that I believe there are some drug manufacturers out there producing higher quality retatrutide out there. It's not legal. Okay. So even if you find pure retatrutide, it is not legal to be dispensing this stuff right now. Some med spas and wellness clinics are sourcing retatrutide from both directions. And obviously, I'm not comfortable with that, right? And I need to be very clear, it's just not legal yet. The FDA has explicitly stated that retatrutide cannot be used in compounding under federal law because it is not a component of any FDA-approved drug. And unlike semaglutide and tirzepatide, which did have a legal compounding window during the drug shortage period, retatrutide has never been approved, so there's no legal pathway at all. So not for compounders, not for providers, not for patients. And then there's the safety issue on top of the legal issue. The impressive clinical trial data I just walked you through, that's for pharmaceutical grade retatrutide provided by Eli Lilly. That's verified purity, verified potency, sterility tested, lot traceable. Every vial in those trials was manufactured under controlled conditions. What a gray market supplier ships you, you have zero idea what's in it. Unknown potency, someone could be massively overdosing without knowing it. Unknown sterility, you could get abscesses, infections, and sepsis. Those are real risks. And the concentration could be far off. You just don't know. It could do nothing at all, or it could be way too high. Okay. So that's a real problem if you think you're being treated with a dose and it's not. So if someone's offering you retatrutide today outside of a clinical trial, they're definitely breaking the law. And you would be taking on all of that risk with no legal protection, no medical oversight, and no pharmaceutical guarantee on what's in that vial. So here's where I land on this. I'm going to be direct. There's no reliable way to know if a med spa is following safety standards or cutting corners. Until now, the Med Spa Board certifies clinics that prove they're doing things right, verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your health and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find certified med spas near you. And if you already have a med spa you love and they're not certified, please send them our link. If you're a med spa owner doing things right, get certified and show your patients you're not cutting corners. As a bonus, certified spas also save a ton on malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there. Retatrutide is genuinely exciting science. A triple agonist that can produce bariatric surgery level weight loss in a once weekly injection. That's kind of amazing, okay? And we're very excited for it. If the drug gets FDA approved and the long-term data look clean, I will be watching it closely. I will probably even try it. And my views could change, but right now, I don't think the extra weight loss is worth it. So here's my math. Tirzepatide can get most patients to 20 to 22% weight loss. That's already transformative. That's already life-changing cardiovascular risk reduction, significant metabolic improvement, and for many people, it's as much weight loss as they need. Retatrutide might get you to 28 to 30%. That is real. But to get there, you're absorbing meaningfully higher risks of nausea and vomiting and a 1 in 5 chance of experiencing that strange skin sensation I described, and a higher likelihood that you'll have to stop the drug altogether because you feel bad on it. That trade-off doesn't make sense to me yet, especially when the drug is not approved yet, and especially when the only way to get it right now is through channels that are both illegal and medically uncontrolled. So if you've lost significant weight on tirzepatide, you've plateaued, and you're wondering what's next, just wait. More data is coming. Phase 3 trial results will keep rolling through 2026, and the NDA is expected later this year. If it gets approved and the long-term safety data holds up, then we'll have a real evidence-based conversation about whether to escalate. But going around the system to get an unapproved drug from a peptide supplier to chase a few extra pounds, that's not a calculated risk. That's just a risk. So if you want a GLP-1 medication, please go to a legitimate provider. Ask to see the vial. Make sure it has a real lot number on it. Make sure the person prescribing it has an actual license to do so. And if you're not sure where to start, the MedSpa Board, that's medspaboard.com, is the place to find certified clinics in your area that are doing things the right way. If you found this helpful, share it with someone who's curious about Retatrutide or any of the new weight loss drugs. Subscribe so you don't miss what's coming next. And we will absolutely be revisiting this as data comes in. And drop me a comment with your biggest takeaway. I read them all. I'm Dr. Kate D, and this is MedSpa Confidential. Stay curious, stay safe, and as always, know who's holding the needle before you let anyone near you with one.